Welcome to America's Top Rebbitzins. In the merit of this class, may Hashem watch over all the Jewish people and bring all the hostages back home and give enormous strength to the IDF soldiers, including Chaim Tzvi ben Tamar Tolza, Hannah bat Panina, Hanan Avraham ben Ari Haim, and Hananya ben Shiratova. Please click on the subscribe button to subscribe to us on the America's Top Rebbitzins YouTube page, or click follow to follow us on your podcasting app so that you're the first to know when an exciting new episode is posted. I am excited to have on today's show Dr. Adrienne Youdim. Dr. Youdim is a board-certified internist who specializes in medical weight loss and nutrition. Her mission is to provide a mindful approach to weight loss that is both actionable and compassionate. She draws on best medical practices in the field of obesity medicine and her patients' personal value system, guiding them to live more physically and emotionally fulfilling lives. Wow, that is refreshing. I can't wait to hear about it. Thank you so much for being here today. Please tell us more about yourself and what you do.
Well, thank you for having me. It's a pleasure to join you. So yes, I'm a physician. I specialize in clinical nutrition and obesity medicine. I am also very interested in and passionate about mind-body medicine and mind-body practices, which I incorporate not only in my medical practice with my patients, but also do extensive coaching and speaking, corporate wellness, and the likes.
I love that. And just to clarify for everybody, when you talk about mind-body medicine, could you just clarify a little bit what that's like?
Of course. So, there are practices that have been around for ages that have popped up in various traditions and practices around the world. And these practices, things like breathing, meditation, guided visualization, biofeedback, these have all now been validated by modern science to demonstrate that they can be effective in regulating mood, but also in regulating our physical bodies. So there is this connection between the mind and the body that we often forget in Western society, but know to be very much to be true. And so instead of working on our physical concerns from purely a physical state, we utilize like everything at our disposal, right? Like use all of your resources and know that our minds and our bodies are very much interconnected. So we promote a approach, and by we I mean the practice is promoting an approach that really acknowledges this truth that our minds, our bodies, our souls are very much connected and intertwined.
That's beautiful. I really, really love that. And it really takes account the whole person instead of just one aspect of them or one symptom that they're having.
Yes, yes. And again, I think this is cultural. It's also in our medical culture. We specialize, super specialize into the tiniest of systems and organs. But at the end of the day, it's an interconnected being that we're discussing, and not only interconnected within the self, but interconnected within the community. We are, I'm sitting here in Los Angeles, California. I was evacuated, but fortunately, my community, my neighborhood, I should say, was not impacted directly by the fires. And what I mean by that is that the house didn't burn down,
Right.
but we are a community. So the people whose houses were burned down 3 to 5 miles away from me, that plays heavily on my heart. I've
Of
had
course.
trouble sleeping. I've had trouble um, concentrating, right? And so when we talk about the interconnectedness, it's not just within the self, but it's also within, our communities and also our global community. How are we impacted by things that are happening around the world? Whether we are personally involved, for example, as Jews or any population that is living in Israel, or Ukraine, where I don't know that I have any relatives there, but continue to be deeply impacted by the suffering that is happening there.
Right. Right. And yeah, it makes so much sense. We totally are all intertwined. And so today, interesting, we're going to be talking about a topic that has received a lot of attention in the media. It actually has to do with your specialty in obesity medicine. It's a topic of conversation among so many women today. It's Ozempic. And so many women are having this conversation because so many of us are trying to lose weight, whether it's 5 pounds, 10 pounds, 20 pounds, 50 pounds, or even more. We all want to look confident. We all want to feel confident. Nobody wants to go to a wedding or a party or bar mitzvah and like hide in the corner because we think that we look too fat, or we think, maybe you have a double chin, or, that we don't look good. We all want to look and feel our best all the time, not just at a party, but, all the time. And we've tried everything. Keto, paleo, South Beach diet, intermittent fasting, intense workouts, Pilates, and for many of us, nothing has worked. Or maybe we did lose a few pounds, or maybe more than a few pounds, but then we've gained it back, those pounds back plus more. So now there seems to be this miracle drug on the market. So enter Ozempic. And I really, today really, really want to take a good and fair look at Ozempic, like the good, the bad, and the ugly. Like I really want to talk all about Ozempic just so people have all the information that they can about it, so they can make an informed decision whether it's for them or not for them. So it's always best to start at the beginning. So to get us all on the same page, can you please explain to us what Ozempic is and how it's used?
So we have hormones that guide our hunger. So, for example, when you eat breakfast in the morning, there are hormones that get released by the gut, by the intestine, that signal to the brain that food has been received, and you can go ahead and shut off that hunger valve. And semaglutide, which is the active ingredient of Ozempic and Wegovy. So the distinction there being that Ozempic, that name has become popular. Ozempic is the semaglutide that is packaged for and FDA approved for the treatment of type 2 diabetes. Wegovy is the very same ingredient, semaglutide, which is packaged and FDA approved for the treatment of obesity, and it's called an anti-obesity medication. So, but in essence, they are exactly the same ingredient. They are semaglutide. So semaglutide is a copy of this hormone, one of these hormones that I'm describing. So GLP-1, which is a hormone that's released by the gut after you eat and signals to the brain satiety or fullness, is mimicked in this chemical formulation of semaglutide. Now, what semaglutide or what GLP-1 does is, number one, it informs the pancreas that food has been received, that glucose has been received, and so it results in a release of insulin. That is why it is approved for diabetes, because you're getting more insulin production, more insulin release to manage your blood sugar. That's number one. But as I mentioned, this hormone will also tell the brain that food has been received, so it signals satiety or fullness, so people feel full. The third thing it does is that it slows down gut transit, meaning the movement in the gut. So the food will stay in the stomach longer, and also in that way helps you feel more full. This, of course, can result in some of the side effects that we can get to, but in terms of glucose and energy homeostasis or metabolism, those are the actions. We are now finding, though, that semaglutide has other impacts. So it impacts dopamine in the brain. And so it has been shown to reduce many compulsions, not just drinking, but also nail biting, compulsive shopping, smoking. We know that it remodels the heart. And there's a lot of data that has come out that has shown that use of these drugs reduce cardiovascular risk. And in fact, one epidemiologic study showed that if we were to give semaglutide to all of the candidates for obesity, which is defined as a BMI or a body mass index of 30 or greater, in this country, we would reduce the risk of cardiovascular disease by 20%. We would also reduce the risk of heart failure and cardiac mortality. So, these drugs are life-saving. not only because they help people lose weight and combat something that they've been struggling with all their lives, but because it literally is saving their life from a cardiovascular standpoint.
Wow. Somebody who's taking either Ozempic or Wegovy, they have less risk of heart attack?
So they have studied it in people who are at risk, right? So individuals who have a BMI of 30 or greater. Now, whether somebody has a BMI of less than that can also benefit. There are probably benefits depending on the degree of excess weight, the comorbidities. But we don't know that somebody who has 5 or 10 pounds to lose is really going to have that cardiovascular benefit or other benefits. They will likely lose weight. And so this medication is really approved in a certain population. People who have the clinical diagnosis of obesity, which is defined by a BMI of 30, or they are overweight, which means they have a BMI of 27 or greater and have comorbidities. So they have maybe high blood pressure, high cholesterol, osteoarthritis, obstructive sleep apnea, esophageal reflux. These are all medical conditions that arise when somebody is potentially can arise with overweight and obesity. And so the point being that this is really a drug that is geared towards health outcomes, not not what's the word I'm looking for? A physical outcome, right? So it's not for an
Right.
aesthetic outcome.
Right.
And that being said, I don't dismiss, the desire to lose weight if you're 10 pounds overweight. I talk about in my book, Hungry for More, I gained 10 to 15 pounds during the COVID pandemic, even though this is the work that I do every day, even though I continue to exercise every day. And I literally wanted to pull every hair out of my head. So I'm not dismissing that. It's just that I want to be clear that there's a role for medications, there's a role for pharmacotherapy. And if you are overweight, then you are, or if you're obese and you're at risk for heart disease or the many other, medical conditions that can arise, then you may be willing to take the potential risk of a medication that is relatively new, not as new as people think, because semaglutide has actually been around since 2011. But you may be willing to take that risk because inaction also has a risk,
True.
right? So
Yes.
you have to weigh the cost of doing versus the cost of not doing.
Right. And for each person, I assume it's different, the cost of doing versus the cost of not doing.
Absolutely. This is a very personal decision.
Right. And so I know you mentioned, I know we were talking about Ozempic, but then you also mentioned Wegovy. And then I want to bring up Mounjaro. Is Mounjaro also in that category, or is that something different?
No, so Mounjaro is somewhat newer class or type of medication that is within the same class.
Okay.
So Mounjaro is it augments or it mimics two hormones. So not GLP-1 only, but also GIP. And both of those hormones impact blood sugar homeostasis or metabolism, as well as satiety. So Mounjaro, which is the name of the one that is formulated, well, the formulation is the same, but it is the branded name for diabetes. And the branded name of tirzepatide, which is the chemical name of this drug for obesity, is Zepbound. So just like Wegovy, Ozempic, same ingredient, Mounjaro, Zepbound, same ingredient, this time two hormones impacting blood sugar and satiety. And as a result, it has a higher degree of weight loss. So whereas the Ozempic or the Wegovy, I should say, it's anywhere in the range of 11 to 18%. Some people experience a little bit less, some people experience a little bit more. With Zepbound, you can see up to 25%, 28%. And again, this is variable. What I should say, what is important to know is that not everybody responds to these drugs. I have patients and even family members that I would love to have benefited from this drug, and about 20% of people do not respond.
Really?
So that's also important because I
Wow.
think if you're getting this medication from a physician and you're hearing all the buzz and everyone's losing weight
Yep.
and you are not experiencing that benefit, it can be very distressing.
Yes.
And so I want people to know that, again, there are individual responses to medications, just like everything else. And I would hate for anyone to feel shamed or to feel, to self-deprecate because their physiology is just not responding.
That's very good to know. I actually didn't think about that because, like you said, everybody's on it. Everybody's raving about it. And everybody, I've even seen like people taking it with dramatic, like really, really dramatic weight loss results, which, is fantastic for them. And I'm happy for them. But I never even thought that somebody could take it and just see nothing, like zero.
Yeah.
Wow. Okay. And it's just an individual response, just the way,
It is. They're just what we call like refractory, just like, I don't know, you could have a headache and take two Tylenol and still have a headache. And you could have a friend who says, I just take half a Tylenol and my headache goes away.
this is true. This is true. Very true. Thank you. Thank you for bringing that to everybody's attention because I do think that's very, very important. And so, I do want to talk about some of the side effects of Ozempic and Mounjaro and all these other drugs. Like, I know that they're made specifically for health reasons, not so much for weight loss, for the aesthetics, but more for health reasons. What are the side effects?
So because these drugs impact the gut, the side effects are primarily in the gut. So people experience diarrhea or constipation. It can go both ways. They can experience esophageal reflux because again, the food stays in the stomach longer, so it has more of an opportunity to come back up and cause an irritation in the lining of the esophagus. In severe, it can cause nausea, and in certain cases, can cause vomiting. Sometimes these are mitigated by the food that you eat. So certain foods, heavier foods, fatty foods, kind of like the food that would make you feel ick anyway.
Right.
On these medications, they really make you feel ick. But for some people, it's not food dependent and they just have violent side effects. And there have been patients that, even on the smallest dose, have significant side effects. And so, we have to take them off because it's just not working for them. Now, there's this term of gastroparesis, which is the slowing down of the gut. And as I mentioned, one of the effects of the drug is to slow down the gut. Like
Right.
it's meant to do that. But there have been cases that it has been severe and that it has affected gut motility, meaning that like even after the drug, the gut is like sleepier. It doesn't move. And so even when people are off, they are having severe side effects. I've heard people who have needed even TPN, which is, a nutrition through an IV because they couldn't hold anything down. I personally, thank God, knock on wood, have not experienced this with any of my patients. I think it's because I'm very conservative. I don't escalate the dose rapidly, and I take people off if they're not tolerating it, or if we find that with dietary modification, like I said, some people are just having these violent reactions. I'm not going to keep these people on the drugs. I think when all the excitement started, and perhaps even now, people are going to physicians that are not certified, board certified in obesity medicine like I am, or they were asking their uncle or their cousin who's a physician to prescribe a drug. Perhaps they were not following dosing guidelines. Perhaps they were not getting the right nutritional counseling. And I think in those cases, you're more likely to suffer severe side effects. Whereas if somebody is on top of you, weekly, monthly, or every 3 months and saying, hey, or having the hard conversations that I cannot prescribe this to you any longer because I foresee that this is going to be a bigger problem down the line. That is, we don't have studies to say a patient who has used it on label versus a patient who has used it off label, what is the effect, right? Like if somebody who prescribed it for you at 5 milligrams instead of starting at 2.5, like how does that person, those two people, how do they fare? But it makes sense to me that the latter, who is not being prescribed in the proper way, is more likely to have suffer side effects.
Right. That
The
makes sense.
last thing I'll say is that there were some reports of pancreatitis, which is an inflammation of the pancreas. There were also reports of nodules in the thyroid in animal studies, cancerous, carcinogenic, so not just nodules, but actual cancer. This doesn't seem to be bearing out in humans in the studies. That being said, we haven't had these drugs for 50 years.
Right.
So I don't know if a, 20-year-old or a 30-year-old comes to me and is on this drug and stays on it for 30, 40 years. I don't have a crystal ball. And so that's why I am just very honest in having this dialogue with the patient. And again, the decision needs to be made on an individual basis. But I, as a physician, so if like I'm counseling my sister and she has obesity and she has had trouble losing weight, and we know that that puts her at risk at X, Y, and Z, I personally would say, well, the risk of inaction is also a risk. But that is a very individual conversation.
Right. Right. No, it's so true. It's very, very true. And it's so interesting because you were talking about like the slowdown of the gut. And this just, I just want to clarify because, a lot of diets, they want to push everything out of the gut. Take fiber, move your gut. Everything is like move your gut. And I've read. So this is actually sounding to me like the opposite of that. Like slow down your gut, like keep the food in your gut.
Well, think about it. Fiber also is it's viscous. It fills you up for
Yeah.
very little calories.
Yes.
So yes, it aids in digestion and mobility of the digestive tract, but it's also filling you up. What I'd also say is that it's not just one thing. Like if losing weight was a matter of doing one thing, like just slowing or speeding up the gut, like we'd be done. But, energy consumption is very complicated because, we have evolved from the genetics of people who were hunters and gatherers, and that hasn't changed very much. What that means is that we are geared towards scarcity being a threat. So anytime the body experiences scarcity, like calorie restriction, even if it's the right thing for you to do because you're 50 pounds overweight, that will send alarm bells off in the mind and the body to try and reclaim those calories. So
Right.
we know, for example, when people lose weight, their hunger hormones, these very hormones that we're talking about, actually shift in the direction of greater hunger. So those hormones that make you feel full are going to drop. Those hormones that are geared to make you feel hungry are going to go up. So people physiologically feel more hunger because that's the body's way of saying, oh my God, you're going to die
Right.
if you
Survival.
keep restricting your calories.
Right.
And this is an important point. Number one, because what do we do to ourselves and to others when they regain weight? We shame them. You're lazy, you don't have willpower, yada, yada. And yeah, you could ignore those hunger signals, but I don't think people recognize it. Literally, your brain is being bombarded by signals to eat. Not only that, but your metabolism is compensating, and there's a whole host of things that occur in the body when people lose weight. The other reason why this is important is because people always talk about these drugs as a short-term fix, and they vilify them because when you go off, it doesn't continue to help keep the weight off.
Right.
But I ask you, if I were to put you on a antihypertensive, so a drug that manages your blood pressure, and you come back 3 months later and I check your blood pressure and we say, yay, Vera, your blood pressure came down, right? Would I then expect if I took you off of the drug that your blood pressure would miraculously stay down?
No,
We would not.
no.
And so we should not have the same expectation about any other drug, including anti-obesity medication.
That makes a lot of sense. It's true because once you stop, so that's the other thing. So once you stop, people gain back the weight. So then the question is this a lifetime drug? Like if you start Ozempic, do you have to stay on it for 20, 30 years or how does that work?
Yeah, so again, I like to use the right terms because Ozempic is really for, even though it's
Oh,
the same
diabetes.
thing, it's really
Right.
for
Yes.
diabetes.
I'm
If I'm
sorry.
prescribing Wegovy for obesity, then yes, I tell patients that this is a lifetime drug. Of course, nobody wants to hear that. And so, I don't like shove it down their throat or inject them, right? So there are times when people have tried to come off, or we've tried creative ways of coming off, or maybe transition them to a first generation drug that has been around for longer as a form of maintenance. And people will fare different ways. I have a rabbi who was seeing me for years and didn't do well on any drug or didn't respond to any drug. He responded beautifully to the GLP-1s. He wanted to come off, and it's been roughly a year, and he's maintained his weight. That he is an anomaly.
Wow.
For many patients who maybe they didn't even intend to come off, but we were facing shortages, at various times, and they didn't have access to the drug, or their insurance changed and they didn't have access to the drug. And unfortunately, many of those people regained their weight.
Okay. Okay. But then that also leads me to the question, like the actual getting off of the drug, and not about regaining weight or anything like that, but the actual getting off of the drug. Is it, I guess, is it addictive, the drug? And also I've heard about people like not being able to get off the drug, like their bodies just like went into shock or they weren't responding.
There isn't any addiction and there isn't any shock. It is just merely, it's very simple. This is a drug that is giving your body a hormone that's telling your brain it's full. Once you get off of that drug, you do not have that impetus to of satiety. You do not have that hormone that is signaling fullness. Now, what may have happened is, someone may have lost 20, 30 pounds because of it. And now, not only are you removing this exogenous
Hmm.
drug,
Yep.
but your endogenous or your body's inherent hunger hormones, as I mentioned,
Right.
are naturally going up. And so, yes, without the exogenous aid and with your own internal physiology trying to get you to regain weight, this is perceived as like a bombardment of hunger. And it is very difficult to ignore a sense of severe hunger.
Right. Right. That makes a lot of sense. Okay. And so do we know, well, I think you mentioned earlier, we don't know yet the long-term effects are for people who take Ozempic. Like somebody who starts now, let's say in 10 years, 20 years, we don't know
I
exactly
mean,
what's going to
no,
be.
I mean, we have this drug has been around, and this class of drugs have been around for, over a decade, close to two.
Okay.
So we do have information. It's not like, it was just created in a back alley and injected, but it's not like something like aspirin that has been around for a century, and even with aspirin, by the way, there was a time not long ago where we used to tell people, oh yeah, take aspirin. It prevents heart attack and stroke. Everyone should be on a baby aspirin. Why
Yeah.
not take a baby aspirin?
Yep. I remember. Yep.
Right? And now we're saying that unless you've already had a heart attack, not even if you're at risk, but if you've already had a heart attack and certain other conditions, you should be on it. Why? Because aspirin actually can cause life-threatening GI bleeds and brain bleeds. Nothing is without a cost. Nothing. Even breathing air in Southern California right now,
Yep.
I just went to my daughter's school to take extra masks and air purifiers. Even breathing air does not come without a cost. So I don't want to overemphasize and I don't want to underemphasize and dismiss, right? Like there's a cost of action, there's a cost of inaction.
Right. I love that you're making it clear because it's so true. I think this is a message that we really, really need to hear. So I appreciate that. So thank you. And so do we, so for Ozempic and Mounjaro and Wegovy, how is it? Is it a shot? Is it a pill? How is it administered?
It is a pre-filled pen, injectable pen. So if
Okay.
anyone is familiar with like an EpiPen, for example, you basically take off the cap, you click it. It's very easy to administer. Some of the drugs like Mounjaro and Zepbound are now being sold in certain doses or made available through the actual company via a vial with a syringe.
Okay.
So, for example, Eli Lilly, which is the parent company for Mounjaro and Zepbound, the lower doses of the drug can be offered via injection, an injectable vial, which makes it cheaper for purchase. That must be delineated, though, from compounded drugs. These are the ones that are made in pharmacies. These are the ones that are being sold on the internet without any oversight or regulation. And those I absolutely do not recommend. Because again, there is no oversight. All we can say is that the FDA approved drugs have these potential side effects. Something that is formulated, you know, we don't know what the exact compound is. We don't know if the dose has been verified. We don't know if there's impurities. And so that's very important to acknowledge as well.
Definitely. Definitely. Thank you. Um, and so I just want to clarify who qualifies for Ozempic. Are there certain criteria that need to be met for a doctor to prescribe this medication? I mean, when we say Ozempic, I know, and I'm so happy that you qualify that it's for diabetes. Do doctors only prescribe it for diabetes, or is Ozempic sometimes actually prescribed for weight loss?
So again, it is the same thing,
Okay.
right? In terms of the actual
The chemical?
ingredients.
Yes.
So, I try and stay true to the label.
Okay.
Um, and so technically speaking, Ozempic is for diabetes. Uh, I'm sorry, Wegovy in this case is for obesity. But if I have a patient who's doing great on Zepbound, for example, or on Wegovy, for example, and now we're facing shortages, but we're not facing shortages for Ozempic. I don't believe there's a hierarchy of disease. So, like, I don't believe that my patient who has morbid obesity, who's at risk for heart disease, should have to suffer and have interruptions of of drug therapy, while my other patient who happens to already have diabetes, which patient A, by the way, is at risk for, doesn't have to have a interruption in therapy. So, physicians can use drugs off label. This is kind of potato because
Okay.
it is the same thing. But, to the best of my ability, I do things that are, the way it was intended. And I think that if all physicians had maintained this professional integrity, we would not have had the shortages of these life-saving drugs for the people for whom it was actually intended. But because everybody was getting prescriptions, again, from their dermatologists and their, cousins, we were faced with a situation where people who really needed it faced interruptions in coverage, and that's unfortunate.
And that makes a lot of sense. Now I understand why. So yeah, no, it's definitely unfortunate. Um, and to decide exactly, how it would come that a person would choose one drug over the other, that's a personal conversation. I just want to emphasize, right? That's a personal conversation that happens between the doctor and the patient, that they decide what drug in what dosage. That's very, very individual.
Yes, you mean in terms of like whether it's Mounjaro or Zepbound?
Or yeah, or or anything at all. You know what I mean? Like, do we go for this type of drug therapy? Do we not go to this drug therapy? Like, what do we do? That's
I mean, I spend my initial consultations with patients are an hour long.
okay.
So, not everyone has that luxury. I happen to practice in a way that gives me that luxury. But I would say yes, it has to be a conversation, and I would say that there's also physicians. There's a growing community of physicians that are specializing in obesity medicine. There's a board certification called American Board of Obesity Medicine, ABOM. People can look them up, can look up practitioners in their area. That's not to say that a primary care physician or a gynecologist, cannot prescribe or is not well versed in these drugs. But I think it's important to ask your providing physician, like, what do you know about this? How many patients have you followed? Are you providing nutritional counseling? How often are you going to see me? If you are skipping doses, why? What is the potential, side effect or adverse outcome that I can expect if I skip the two initial doses and go to the third? These are important conversations to have with your physician.
Thank you. And I really appreciate those questions because these are good questions for people to keep in mind when they go see their doctors. It's really, really important. So thank you. And we have time for just one last question. So I know that you have a compassionate and empathetic approach to weight loss, which I think is amazing. And that really resonates with me. So can you tell me what you would recommend to somebody, like let's say me, let's make it personal. Can you tell me what you would recommend to someone who really does want to lose weight, but either doesn't qualify for Ozempic or Mounjaro for any of the other drugs, or would rather try a different approach? In your experience, what approach to weight loss helps people both lose weight and also keep it off permanently?
So, of course, I talk about diet, exercise, sleep, hygiene, all of these things that are important. I spend a lot of time talking about mindset, emotional hunger. The very hormones that we're talking about
Hmm.
actually change in response to stress and emotion as well. So, ghrelin, which is a hormone that is released by the stomach and signals hunger in this case, not satiety, as we've been talking about. Ghrelin levels go up in times of stress. And so I have a TED talk that is 10, 12 minutes long that talks about this. My book, Hungry for More, is a very in-depth conversation with patients. It is a series of very personal stories and patient stories talking about how things like self-compassion, autonomy, a sense of purpose and meaning in your life, how all of these various things that, we still don't, we're getting better about talking about these things, but I think people in our generation, I'm going to assume, Vera, you and I are kind of the same generation,
Yes.
that it's not something that we were raised with. It's not something that we talked about. We were um, raised to pull ourselves by our bootstraps and march forward,
Yep.
which, look, has to be done. But it can be done in a way that is self-compassionate, and sustainable. And in fact, the science shows that lack of self-acceptance and lack of self-compassion actually undermines our health goals and our ability to adhere long term to the changes, like the dietary or lifestyle changes that we seek to change. This is very important. So if a self-compassion practice is making you more likely to adhere to all those things that we already know, then why are we not spending time talking about those things? And so this book was really like a love letter to the patients, because I wanted people who are usually, again, ashamed or self-deprecating and not engaging in positive self-acceptance or self-compassion, to understand why they were undermining themselves and to offer them another way of being. And the last thing I'll say is that Vera, I really am passionate about this work. I love this work, not just because it helps people lose weight, that's wonderful, but because our relationship with food, our relationship with our bodies is really a mirror into our relationship with ourselves and with the way that we walk in the world. If you are going to be so rigid with yourself and your food choices and whether you gained or lost a pound or two, I promise you that you are carrying that perfectionism into your parenting, into your relationships, into your workplaces. And not only are you compromising your own success, but that behavior is impacting your children, your partner, your coworkers. And so, really taking a hard look in how we are treating ourselves in this pursuit is it's a gateway to making life changes that can have profound positive impact in your life.
Very beautifully said. Thank you. And thank you so much, Dr. Youdim, for joining us on America's Top Rabbits. It was truly, truly a pleasure to have you with us. And in the merit of this class, may Hashem watch over all the Jewish people, bring all the hostages back home, and give enormous strength to the IDF soldiers, including Chaim Tzvi ben Tamar Tolza, Hannah bat Panina, Hanan Avraham ben Ari Haim, and Hananya bet Shira Tova. Thank you so much again.